Good afternoon, and welcome to the 100th session of the Flint Community Webinar on Coronavirus, February 11th, 2022. 2022. We're so excited that you've joined us today. And this session is sponsored today by the Flint Center for Health Equity Solutions, the Healthy Flint Research Coordinating Center, and the Prevention Research Center. And again, let me welcome you, whether you've joined us by Facebook or you're joining us right in the webinar. This is a very special event for us today, and I'm excited to be your moderator, Yvonne Lewis, as the co-director of the Healthy Flint Research Coordinating Center. This has been quite a journey. And of course, we did not take this journey alone. Over this 100 weeks, we've had a significant number of partners within Flint, Genesee community, as well as the state of Michigan that have been partnering with us over these last few months. And today, we're really excited to have a partner with us. Today, we have a partner with us has joined us at the Office of the Regional Health Administrator, U.S. Department of Health and Human Services, Region 5. And I will tell you that one of our favorite, I'll say promoters has been Mildred Hunter, who is the Regional Minority Health Analyst for Region 5. And we're so excited that she's here and has partnered with us over this last few weeks and is here with us today. Again, could not have done it with all the wonderful partners. So we have a special session for you today. We're gonna have a general conversation, and the information that we'll bring to you today is really pointed to what we have experienced in this 100 weeks of this global pandemic. And one of the things that we said to you when we started this webinar is we wanted to bring a local context to a global issue. This pandemic has brought us information and experiences that I don't think any of us could have ever imagined. So what has it been like over this 100-week COVID-19 journey? What has been our community context as we put this pandemic in a local context? And what have been some of the lessons learned? You'll hear voices of community day, our experiences. You'll hear voices from our hospitals and health department. And those of you who are in the room with us, please feel free, put your questions and comments in. I'm excited to say we already have our first question for our group today. So put your questions and comments in, and let's join in this conversation together. I want to begin by asking us to take a little bit of a pause. This is also Black History Month, and we're focused in on Black health and wellness. We've also talked about the health disparities. This COVID pandemic has really elevated some of the challenges that we've seen historically, and now they're so vivid to us. We must do what we can to address them. And so I want to ask Dr. Deborah Holden if she would come and give us just a glimpse of what we've seen over this last 100 weeks as it relates to COVID deaths. Now, we don't always like to start off our conversations with something that looks challenging, but I think it's important for us today to just take this moment and look at what's happened over the course of this 100 weeks as it relates to our communities. Dr. Deborah.
Hi, Yvonne, and happy 100th. That's no small accomplishment. Who would have thunk it when we started this, that it would be 100 weeks later? Who would have thought? I remind people that, I hear all these myths and people say, hey, well, Omicron's not so bad and blah, blah, blah. And I just caution people to consider that that's not entirely the way to view this, right? We are very much still in this pandemic. And people are still contracting COVID and people are still dying from COVID. And who would have estimated that after Delta, we would have an even more infectious strain, and people are still dying from COVID. So if you put it in context, in the US, we've had over 900,000 COVID deaths, and you've probably heard that number before. In Michigan, 32,911 of those have been within the state of Michigan. And we just kept drilling down in Genesee County. And these data were updated as of 2/7/2022. And you can also get the county and the city stats off of gchd.us. The health department has all of this stuff up on their site. 1,556 deaths in Genesee County and 353 deaths in the city of Flint. And I don't know about you, but for me, those aren't trivial numbers. And the thing that I think about these deaths is many of them were preventable. You know, that's the thing that I really have got reinforced for myself during this pandemic, is the power of prevention and us using all the tools that we can to prevent people from contracting this in the first place.
Thank you, Dr. Deborah. And so we want to just take a moment, as I said earlier, lest we forget. That's one of the lines in the Negro anthem, lest we forget those who have gone on before us. As Dr. Deborah said, this is preventable. And so we want to remember those who we've lost, but we also want to think about those who are still here and are still challenged with some of the impacts of COVID. So just want to take a moment of silence for us to really get where we are at this time. Thank you. So we've been 100 weeks now, and we're going to open this up to our entire panel. For all of you that are here to be with us today, we're going to open this up for a conversation. It has been 100 weeks. We've had many of our partners be on with us, so I'm going to just ask our partners, and I want to really start with some of the lessons learned. And again, I'm going to bounce this to you, Dr. Deborah, because you mentioned the Omicron virus. But when we started this conversation over 100 weeks ago in the Healthy Flint Research Coordinator Center, we were planning for our symposium. 200 people already getting ready to come to a research symposium. And we hear the notes from the governor that says, no, we're not going to do that. We have this virus now that is affecting our community. And within those days, the very first days, and sitting in that meeting, I got my first phone call of someone that I knew that had died from this virus. And it just kept coming and coming. And so we talked about not knowing anything. We just called it COVID-19. So we went from Alpha, and now here we are at Omicron. Dr. Deborah, you're the epi person. What is this? How did we get from point Alpha to Omicron? And you're marvelously on mute, my sister.
Yes, wonderful. So if people know the Greek alphabet, you know there's a lot of letters in between Alpha and Omicron. And we heard about Delta. Even there's a lot between Delta and Omicron. So what happens is, if viruses mutate, all viruses mutate, that's not news. This particular coronavirus looks like it mutates maybe more than some of its predecessors. But I remind people, coronavirus is the same family, the same class of viruses as the common cold. So these are viruses that have been with us for a while, but this particular coronavirus is new to the human population. And so what happens is, as the virus mutate, and it mutates when it goes from person to person, sometimes these mutations will stick. And if it sticks and you start to see those, those same mutations show up in multiple people, and two criteria: it causes either more illness or it seems to spread more easy, it'll rise to the level of what's called the virus of concern. And if that virus of concern replicates in the population, it then gets its name. And just like, hurricanes, they name them from, Andrew, Betty, Charlie, Doris, they go in the alphabet, they use the Greek letters. And so we've had some variants of concern. And Omicron just happens to be one that, really kind of took us by surprise, because while by and large, it looks like we have less severe symptoms, it does spread very, very easily. The estimate is about 70 times more infectious than even the Delta strain. And Delta was estimated, I think, to be 40 times more infectious than the strains before that. So the virus is getting tricky. And I always warn people, we might be over COVID, but COVID is not over us.
Oh. That's very interesting, because it is affecting us in so many ways. And the last couple of weeks, we've talked about how this has affected our mental health. And Carrie Channer is here with us from the Genesee Health Systems. And we've had her come on and talk about this whole mental health component and the impact. Carrie, can you give us some insights over this 100 weeks from a mental health perspective? What have you seen?
We absolutely have seen an increase nationally with crisis calls and locally as well. I think we're still waiting for the final data to come in, but all of the initial data is showing an absolute increase in spike in crisis calls, a number of intakes, and people experiencing mental health symptoms, including our children, which is a huge priority population. The fallout from this is going to be years. And so, we really need to expect to see some increased mental health situations and problems as a community. But, GHS is here and ready to combat those as a team with our community. We're really fortunate to have that mental health millage that is starting to be implemented, and very excited to see what we can offer this community in addition to what we already do.
Thank you, Carrie. And today we have two of our community members on that have had personal experiences, and we're going to ask them to join us. Denisha, this is your first time being with us on our webinar. We welcome you today in your very interesting story, personal story from two perspectives. So can you share with us, Denisha?
Thank you. Thank you for inviting me. Yes, my personal experiences, I had COVID. I had COVID in March of 2020 before we really knew a lot about it. I remember becoming very ill, and my beautiful son was like, "Oh, Mom, you don't have COVID. Nothing's wrong with you." And I began to get sicker and sicker, and I knew something was wrong. I was having trouble breathing. I would feel like someone was pushing me underwater, or a suffocating feeling, pain and weakness. And I remember lying on my floor in my bedroom, thinking I was going to die, thinking I would die in my room. I tried to go to the doctors, and I tried to go to the hospitals, and I was turned away. I wasn't old enough, and I wasn't sick enough to be admitted. And I remember finally getting in to see my doctor at the time, and he did not test me initially. He said I had maybe a viral infection. Looks like you might have upper respiratory something going on. And I remember going back and just being very persistent. And he tested me, and I was positive. And at that time, the test took a long time to come back, days. And I suffered with the symptoms of COVID for easily 30 days. I remember him giving me hydrochloroquine. And it was right before, or probably the day that they stopped giving hydrochloroquine to patients. I remember my husband being sick, and my children bringing us dinner. The things that we did for them, we could no longer do. They were putting food outside our bedroom door. My mother became ill. She was hospitalized, and it just seemed to be that every day someone was dying, someone I knew of. I watched entire families leave this earth during that time period, and it seemed that there was no cure. And health officials were saying that to me personally. There's nothing we can do for you if you do not come here. Do not come here. If you don't have it, you're going to get sick. Don't come here to emergency rooms. I remember calling even a prominent hospital that I'm a patient of for other reasons, and being told not to come. So it was a very devastating time for me personally. But then being a leader of a school, it impacted me another way. I remember hearing that there was a virus, and that we needed to begin to prepare for extended learning. We needed to prepare a safety plan and a security plan. And I sat in this very room with my team of leaders, and they're like, "Oh, we're going to be fine." I said, "It's going to be bad. I can feel it." I just felt like something really bad was coming. And I remember setting out our plans, and we did a wonderful job, in my opinion, of preparing for online learning, getting a device in every scholar's hand. But the aftermath, and I can't say after because we're still in this thing, but the aftermath, if we were to say we're on our way out, has been catastrophic. It's been something that I barely find words to describe for my scholars. The academic impact for a third grader whose last normal school year was kindergarten, has been devastating for their academic growth. Uh, the mass grief that we're experiencing. And then we did this on the backs of the water crisis. We did this on the backs of a food shortage, healthy food shortage in North Flint. We are experiencing this at the schoolhouse, the way I like to say it, uniquely. Flint is experiencing this in a way that no one else in this world can say they're experiencing it, because we're dealing with two crises happening. And it has been extremely difficult for educators and for scholars to navigate naturally, the natural things we know about school, being able to come and gather at carpet time and play with the Unifix cubes. And, everything has had to be rethought. The way we gather, the way we make sure we have hands-on learning. We went from sharing snacks to everyone needs their own, and so it's been very impactful in that way. And I'm a talker, so.
So the overall impact, so you're looking at it from your personal experience and then what
Mhm.
you're seeing as it impacts the overall community. And we're going to come back and ask you, so for some of the other tips that you use to help minimize some of the impact for the students in the school where you work. I want to shift over to Arthur Woodson, who is also one of our community advocates. We hear his voice in many, many places in the community. And as you said, this isn't our first crisis. We've moved from trauma to trauma to trauma, and yet we still have to figure out how we would deal with this coronavirus issue and what were our perspectives on it. So Arthur, would you share your perspective? Because you have a little unique nuance in what you've experienced. So Arthur.
Yes, thank you all for inviting me and allowing me to uh, be on here with you all. I feel so honored to be amongst you all. Mine is different. When it first started, I was out here, really looking and watching what was going on, and I saw where China had built a hospital in 10 days. They were talking about it, and you know, we was in the communication meetings on Thursdays, and they were saying, well, we only checking people who flew over here from from out of the country. And one of my main questions was, what if somebody came in contact with somebody over in New York that flew in, and then they traveled on, in a car and came back to Michigan, and they have it, and they go to the hospital, and the only questions was, did you travel out of the country? I might not have traveled out of the country, but I had contact with somebody over in New York. So it was a lot of different things that was going on. And, they were bringing in the vaccination, and they was talking about it. And I was like, man, you know what? I'm not taking that shot. I don't care what anybody say, because it was so many different messages. They was talking about taking horse pills, and you don't have to take the vaccine, and you know, dealing with the past, especially dealing with Tuskegee experiment, and how they used to talk about how they experimented on black men with syphilis, and all this came to mind, and you sitting up there, and this rushing through your mind that, hey, you know what, it's an experimental drug, it's going to kill you, and all these different things. And one day I just thought about it. I said, man, you know what, as a person who calls themselves an activist or a leader, you have to put yourself out there to where, hey, look, you know what? I don't like to speak about nothing that I wouldn't do. I don't like to tell anybody, hey, you do this, and I don't do it. So one night the VA called me and asked me that I want to take the shot. And I sat back and thought about it. I was like, you know what? As a person in the community that's out there, if something happens to me, they know that I took the shot, and it would show that, hey, this shot isn't any good. Hey, it messed our Woodson up. Or it can benefit as far as I'm not out here saying, hey, you take the shot, because I didn't want to advocate at the time. I just wanted to let everybody know that I took it and I'm still here. And that would probably, get others to take the shot because I took the shot. But the main thing that convinced me into taking the shot is that, like I said, I'm a veteran, and I thought about it. I was like, man, you know what? When we got into the military, they was hitting us with like 5 and 6 shots at a time in our neck, arm, everywhere. And to this day, I still don't know what it was that they shot us up with. And I'm still here. And I was like, man, you know what? I'm gonna go and take the shot and let everybody know that I took the 2 vaccination shots plus the booster. And I would rather be alive and making the choice of taking a shot than to be in the hospital on a ventilator, and they're using experimental drugs trying to save my life. So either way, I was looking at it that either way they're gonna use some type of drug on me. And as we spoke, I thought about it also. mRNA has been around for a long time, so it's not like it's something new. But I still, had questions about it. And, like I speak to everybody else, I'm not going to down what you're saying, vitamins and all this other stuff, but they say eat healthy and take these vitamins. Well, you have to build your immune system up to that. If I wasn't doing this yesterday, it's not like, I start taking all these vitamins and all these different things today, it's going to save me. You have to build yourself up to that. But with the vaccination shot, I'm ready.
So you make some good points, and I call you brother Arthur, because this way we talk. You make some good points, and one of the things I think is really important, we've learned over time. As Sister Denisha said, we knew nothing about this in March of 2020. We learned something about it. Many of us had many questions that we're still trying to get responses to those questions now. But it's important for us to have good information so we can make informed decisions. And we did have a lot of misinformation that was provided to us at first. So we're trying our best through this webinar to provide some information and some perspectives that will allow us all to make some good quality decisions. Now, I don't want you to go away because I'm going to call you back, but I saw Dr. Wolford come on. Dr. Wolford is actually in clinic. And as we started these conversations all of those weeks ago, she was in clinic. And here she is now in clinic, still masked up. So Dr. Wolford, help us to understand. You've given us so many wonderful examples over this 100 weeks of trying to really understand the virus and its variations. And what should we continue to think about based upon what we learned in the past and where we're going? You're in your pediatric clinic with your babies.
Thanks so much, Yvonne. Yes, hi everyone. I'm actually not in clinic, I'm in the hospital. And that is what, as I thought about the past 100 weeks, when the pandemic started, we were all called to do more clinical work than we previously had to do. And so at that time, I was deployed to the nursery, to the hospital, and spent many weeks here. So being back here at 100 weeks in just felt a little bit like deja vu, that I'd been, we've been here before. And certainly when this started, and I'm sure you've said it already, we did not think we'd be in this position, 100 weeks later. But the thing that jumps out to me is how much we have learned between then and now. When we started this out, we didn't know what to do with babies when they tested positive. We didn't know what would happen if moms were positive, how we should treat the children, whether they should breastfeed or not. So there were a host of things that we didn't know then, and we know so much more now. But the other thing I think that is really important is that we know we don't know it all. And so there is a lot more to learn. So if it's one thing that I would say is that we should keep learning. Just don't rely on the information that we had just last month or the month before. Keep adding to that information. Some things we know. We know masks are good. We know that they help protect us. But in the beginning, we were using cloth masks, and now we know you probably need to double up on the surgical mask or wear an N95. So I think that is the really important lesson, to continue learning.
Thank you, Dr. Woodford. And in that learning mode, we have two really, really important things that we've learned. Number one, it was very difficult for us early on to get vaccines. And and there were some disparities there. There were some differences there. There were some health differences. We had more African Americans that were dying. And I think you pointed out too, Denisha, you said you couldn't get in. You were young, and so you weren't old enough. And so going back here to Dr. Deborah, and then I want to ask Joanne Herman and Aurora to get ready, because I have a question for you. But Dr. Deborah, how do we deal with these disparities that were becoming so starkly relevant or clear to us during that early part of the pandemic?
Yeah, I think that this notion of these disparities in health and healthcare are not new. They predated this pandemic. I always say COVID is the snitch. It just told the story. It didn't create the problem. Some people call it the flashlight. My colleague, David Fakunle, called it the revelation. Whatever you want to say, it didn't create the problem, but it did bring a lot of light to those problems. I think one of the things that really matters is bringing an equity lens and an equity focus to the work. I think some very well-meaning people had to make some tough decisions about how to stretch out thin resources, not realizing that unintervened, you will bake inequity into the process. So like in Boston, they created a point system to prioritize patients for admissions, and for ventilators. And the more points you had, the lower priority you were. So you got a point if you had diabetes or hypertension, you got a point if you were overweight. And we know a lot of those things are disproportionately higher among African Americans. So this point system actually kind of had baked into it some discrimination. But the people who were making that list were really trying to play the odds and say who has the best chance of survival among those who need a ventilator. But it wasn't equity centered. Even in the state of Michigan, when the vaccine rolled out, we said, oh, we're going to, the legislature said we'll prioritize communities that have higher proportions of people 65 and older. I said the communities that have higher proportions of people 65 and older are whiter and wealthier. So if you do it that way, you're prioritizing whiter and wealthier communities, which means you're disparaging, Black or browner and poorer communities. Did they intend that? No, but if you don't have that equity centering and that equity lens, you'll make well-meaning decisions that will actually further inequity. And so on top of some of the just real intentional and explicit biases in our system, we have a lot of well-meaning people, I think, not steeped in equity, who were doing things that only made things worse.
And so what we were able to do is here set up some committees and task force that really looked at the equity situation. And so we're excited about that, and that work continues.
And to have those conversations in safe spaces. I must have gave my health equity 101 talk probably 50 times in the first 45 days of the pandemic, because I wanted to make sure that the people who manage resources, the people who are making decisions, at least had a primer in how to think about some of these things. Because again, I don't think there was malice or even bad intent in some of the things that were done, but it was inequitable nonetheless. And so I think, the opportunity is we're getting better and stronger. And now I listen to some of my colleagues and people who were not in this conversation before COVID speak about equity with real authority now. And these are people who hold resources and make decisions. So I'm like, I hate that it took this for us to get there. And I wish we could figure out how to take this model and scale it up and out in other places. Because Flint is not the only Flint. Many communities like Flint with smart, well-meaning people who just don't get it. But if they did, they would do better.
Right. So one of the things that was done in Michigan, and particularly a focus on Flint, Genesee County, was Michigan United. I know, Aurora, you've been very busy as an advocate working with Michigan United and with our Hispanic community. Can you give us some insights from your experience? All right, Aurora, you're really telling us good. There you go.
I know. So yeah, thank you for allowing me to join you, Yvonne. I wasn't fully prepared, but I can speak from the heart that our Michigan United Public Health Navigator program has really put a dent in the needs of our community. And we are so fortunate that we've been able to work with the health department just side by side, and other nonprofits also. We have a great nurse team who has been out there, and we were able to vaccinate so many of our community because one of the churches happens to be Our Lady of Guadalupe, where most of the people attend. And at the same time, those people have been able to reach out to others that don't attend that church, but have that language barrier and have come to us. And so the other great thing about our team is that we are actually going to them. And that's one of the things, you know, that some of us didn't realize at the beginning. Hey, we're going to set up a clinic here and a clinic there and a clinic over there, and then they can come to us. Well, we have discovered now that we need to go to them. So we're doing, you know, one, maybe two. The other day, Joanne can attest to this. She and another med student went out to a restaurant and vaccinated 3 people there who had an outbreak of a couple of weeks before that. And so in my own personal experience, I have paid the price of losing a couple of my family members because they didn't want to get vaccinated. And I just don't know what else to do. I think right now, the biggest hurdle is to try to get those people that still are not wanting to get vaccinated. But we're going to continue. We're not quitting. It just seems like we have to go out and about and explain, and, in a nice way, because also it's so important that we be as empathetic as possible. But yes, I am so thankful because our Latino community, and mostly our undocumented community that usually gets forgotten, has been reached out to, and I had a young lady the other day, and Joanne was there. She came from Michigan State University to get her booster because she was told that she would have to get her booster to go back to face-to-face class. So she came from Lansing over here to Flint to get her shot on Tuesday. So yeah, thanks for allowing me to share, Yvonne. It's nice.
Well, thanks, Aurora. Just stay here with us, because you talked about that link between what you're doing with Michigan United and our community members to working with the health department. That's one of the wonderful things about our community, is that we are really beginning to do a better job at linking all these services. Now, Joanne was supposed to be retired, I think, and working with the health department has come out of retirement, but it is important to have those opportunities. Joanne, can you tell us about what you've seen, especially in terms of what our community is doing to make sure that there is access to these resources?
Thank you, Yvonne, and thank you, Aurora. Yeah, partnership is one thing, meeting people where they're at. As everyone knows, we've had a variety of pop-up clinics in just about every area of Genesee County. Our team is consistently going to the 3 churches, but we are also going to homes. So for example, when we're at Our Lady of Guadalupe on Tuesdays, any of the surrounding area, we will, our team of nurses and doctors will go out to the homes, do home visits for people that have difficulty with being able to get in and out of their house. So we have been doing that in a big way to supplement. We've been going to schools, you name it, and we're very open to meeting people where they are to really open the doors. Last night we were at Shiloh, and I think we did about 10 people for their first doses. And that may not seem like a lot, but 10 more people decided to get their first vaccine yesterday than we've seen in a while. So it's baby steps, but it's going forward, and it feels good to be able to contribute to the community.
Thank you so much. I want to jump back to you, Arthur. When we talk about contributing to community, you've been a strong voice, and sometimes you were on the opposite side of the fence about what should happen. And so tell us what ways you are now encouraging some of our community members.
I like to give my thanks to Dr. Verhoeven, because that's my go-to. Anybody that has questions, I call Dr. Verhoeven 10, 11 o'clock at night and ask her.
You ain't supposed to tell all that secret now.
It's true though. It's true.
I mean, because it's something that I don't want to forget. If somebody asks me a question in the public, you know, I want to give them an answer so that I don't forget. So because it's something that they want to know about the vaccination shot. We've been doing Zoom together on Sunday evenings, trying to get the word out, letting people know that this virus is real and it does kill. And just you know, the messaging sometimes be messed up, and you know, people don't know how to talk to others in the community. You know, you know, you have scientists. They only know how to speak scientist language. They speak over the heads of the people in our community, and I try to get the information so that I can break it down, you know, to where all of us can understand, and you know, it doesn't keep the people tired, and you know, they don't go to sleep. And I mean, it's
Yeah,
it's
so
just that,
it's a process, right? It
right.
takes us learning from each other, and I think that's another reason why these community and academic partnerships are so extremely important, because we have to sit in the same rooms and talk to each other. Our medical professionals, we have to talk to each other and understand how to bridge these language gaps. And so I want to shift back over here to you 1 quick minute, Denisha, in talking about bridging language gaps. When you talked about how you had to talk to your children in your home, but also you're talking to children in the school systems about some of the things that they need to do to maintain their health.
Yeah, I definitely, we think that we've had to really explain the why. You know, why are we still wearing masks? Why are we walking one way in the hallway, Mrs. Smith? You know, and you know, we always say, well, we want to live, you know, we want to see you every day. And that's my response. We just want to live. We've discussed, we put splash guards on every desk, and we had to have conversations around why we sit in only one seat, you know, and we talked about how you can get dirt on someone's hand. Just imagine this is invisible dirt. You can pass it all around. And so we've had to break those conversations down. We've been blessed to be on the calls every Wednesday with the Genesee County Health Department, staying up to date with research. And also Sesame Street has done a phenomenal job. We're putting videos together. So we've tapped into those videos and anything that we could do to provide kid-friendly language around the pandemic and around why we're trying to stay safe.
So we see, even in the midst of this multiple trauma experiences that we're having, we're finding ways to strengthen our ability to meet the needs of our community. I want to just, there's a question in the queue I want to get to. Hopefully Dr. Wolford and Dr. Deborah can answer this, because it's about boosters. And I know we've really been challenged with this. I got my vaccine. I got my second vaccine, so I'm fully vaccinated, and then I got a booster. Some people still got COVID as a result of that, because early in our conversation, we were saying, get the vaccine, you don't get COVID. But now we realize what we call breakthrough cases. And now we have people who are saying, well, I don't got my both vaccines, but why should I get a booster? What say ye about that? We've got a medical professional and an epidemiologist. What do y'all say?
So I would say that in the beginning, even when we said that you should get the vaccine and we had just the initial studies, we should have explained more, because we said, if people remember, the news that came out was that it was 95% effective, right? That meant that some people who got the vaccine were still going to get the disease, right? Because it was 95% effective, not 100% effective. It was not like a, I don't know, bulletproof vest. It was very effective, but there were still some who were going to get it. And then the other interesting thing that we didn't describe in great detail is effective against what, right? So in the beginning, those tests were saying it was effective against symptoms. They didn't know initially about whether or not it was effective against preventing infection. They just knew it was effective against preventing symptoms. So now we know, so I think we should have conveyed that initially, because then when people saw that, well, some people were getting cases and some people were getting infected and they were asymptomatic, they were like, well, we didn't know that was possible, but it was possible, and we should probably have explained that. But the important point is that back then and now, what we know is that the vaccines are protecting against severe illness and death. So the simple thing to remember about this is that we should get the vaccines because they are protecting against severe illness and death. And while none of us want to get the infection, and so we take all of the precautions that we should, we really don't want to end up on a ventilator, and we really don't want to end up passing away as a result. And I'll just throw in one other little reason for getting the vaccine. As I'm here in the nursery, Dr. Deborah was reminding me of this last week, that one of the best presents, gifts that you can give your newborn is some antibodies to help them fight off illness. And it appears, and the studies are suggesting, and of course there need to be more studies in this area, but it appears that when mom has antibodies to COVID, she's able to pass those on through the placenta to the baby and give them that gift of some protection. So we believe that that is possible, and that's one of another reason. If people didn't have enough reasons, here is another reason to get the vaccine.
Now you're on mute, Yvonne. This is a good art question too. It's a good art question too, because Arthur Whitson called me in an uproar. I got the vaccine and now I got COVID. He got the COVID within days of getting the vaccine, right, Art? About 2 days. And I could not convince him that he did not get COVID from the vaccine. And then he said, I haven't even been around anybody. I'm like, man, I'm looking on your Facebook page right now. I see you like hope get your arm around somebody. So we got all of that sorted out. So, but it does leave this question, and I'm a little bit picking on Art because he's my buddy. But if you get COVID, you should still continue and finish your vaccine regimen. Why? That's where you get the full benefit. And I'll be honest, I had both doses. I was scheduled to get my booster, and then I contracted COVID before I got that booster. And now MSU has a policy. They want everybody to be boosted by February 1. I personally chose, I said, well, I just had COVID. I tested positive on December 1. I would like my 90 days of my good antibodies. And I thought, we've got a lot of stuff happening. We've got second generation vaccines coming out. Maybe they'll, some will be more specific to some of the, more current strains, et cetera. And I thought, I made the decision with my primary care physician that I would wait 90 days to get my booster because I've got, the immunity that I have from infection. And I thought there's no added value for me getting the booster right after my infection, especially if other vaccines come out. And then MSU said, but we want you to get it by February 1st. And I got mad because I had my heels dug in because I had a plan that I came up with my primary care physician. And now I was having my hand forced. And I ultimately got it because I just got tired of going back and forth. I got it early with the university. And the thing that tipped the scales for me is a couple of my physician colleagues said, here's the deal. It will do you no harm. It won't do you any harm if you get it. I understand why you want the 90 days, right? Because there is good data that being vaccinated and contracting COVID, you kind of have, the newspaper calls it super immunity. I call it Wakanda blood. But, you do have some protection, right? And yeah, it's true. If you wait until that sort of 90-day mark, you'll get that added then boost of your booster shot. The mandates at my university dictated that it happened a little bit sooner. And I can happily report, I basically got my booster without incident. So I do want to underscore how important I think it is for people to have a primary healthcare provider to talk to work those things through with, to make decisions that really make sense for you, but that are informed by science and the good advice you'll have and get from your primary healthcare provider. Because, it wouldn't surprise me if we see more mandates on the horizon. And in that instance, I just think, having knowledge and being able to make good informed decisions for yourself will be empowering. And I know not everybody has a cell phone full of physician friends, you know, and so the relationship with your primary healthcare provider is just critical. And if you don't have a primary healthcare provider, please get one. Everybody needs that.
Yeah. Thank you, Dr. Deborah. Now I'm sitting looking at Dr. Wolford, and for those of you that are in the webinar, you can see she has on a mask, and she would say a mask, but she has on her mask. Dr. Deborah, I just need you. We only have a few minutes left, and I got so many more people I want to talk to, but we want to emphasize the importance of some of the same things we've talked about the last few weeks of these protocols. So we had a conversation about the mask, because early on, we were told just a surgical mask would do, and now we're hearing you got to go to the KN95 and sometimes wear a double mask. So give us that really succinct information about why it's important to wear the mask and how to wear it properly. Okay, I think she's frozen. So we'll come back to her. Oh, Dr. Deborah, could you hear me? Yes, because you were frozen.
Oh, sorry. I thought you were talking to Dr. Wolford about the mask.
Yep, I said she has on hers. I want you to give us that example.
Okay, great. Because a lot of people just still have these. And remember,
Right.
we said now what matters, and this is specific, right? Things change. Omicron spreads a lot more easily. What really matters is fit and filtration. So you'll notice, I'm gonna take my glasses off. When I put my blue surgical mask on, which seemed to provide a pretty sufficient level of protection, especially when everyone was wearing them, it doesn't, you know, like it's kind of gappy. And I always make it a point, and this is how you know when you have it on upside down, the little metal piece should be on the top and not so you can pinch it on your nose. It's not super well fitted. So if that's what you've got, no problem. I got my Say Their Names mask, which has the names of people who were victims of police violence. And I'll put that on over top of that, if that's all I've got. So double layer if you're using the surgical mask with a cloth mask. If you have, and the city has a bunch of these KN95 and N95 masks. I went to CVS to get my booster shot when I was in Baltimore, and they gave me this N95 mask, which I really love and think is super great. It was actually one of the best masks that I've worn. It has the two straps. So you have, how you put it on is a little bit different. You know, the other one we put around the ears here, but I really like this. It's got this nice little foam here. It's got the metal so I can pinch it, and it's got this chin girdle. And I had to go through the airport, but you put this one on a little bit different. This one goes under your chin, and it's got the two straps. And one kind of goes down low and one kind of goes up high. And then you pull the chin strap down below your chin, and then you pull the top part above your nose. And again, you pinch it. And always put your mask on with clean hands. I love this mask. I feel like I can breathe. And it is so tight fitted. All I did was pinch the nose, and see it goes all the way under my chin. So all of this is covered, all the sides are covered, and you can rewear these masks, which I think is cool. You can take it off if you know, just in case you've been out, because they do have this electrostatic charge. So they draw these molecules. And remember Dr. Wolford's great demo where the molecules kind of clump up together and so they don't get through. This mask I love. So I will be taking good care of the 3 free masks that I got. I wore one because I put this one on. I got a paper bag. I will put it in my paper bag and set it off to the side over where we have our masks when we come and go. I have the paper bag has my name on it because I don't want the kids wearing my mask and I don't want to wear theirs. But I just really encourage people. The other thing that I found really interesting about this mask in particular, and this mask, which is just a KN95, more like the surgical mask, but it has better fit and filtration. It is much tighter. It's still tight around my face, around my chin. I can breathe. This mask does not fog my glasses up ever. The only way for me to not have my glasses fogged up with this one is I have to be sure to put the glasses over top of the mask. So we've got lots of innovations in masks. We now know not all masks are created equal. use what you got, but wear the mask. If you got to wear this one, double it up. If you go get your booster, get you some of these freebies. And also your KN95 does the job too. Fit and filtration.
Thank you. And Dr. Reynolds wasn't here with us, but he would say those layers of protection. Masks are one, washing hands is one, being sure that you get your vaccination is one, and socially distance. He said, be sure you don't have to be around lottie-dottie and everybody. But those are still very important things for us to follow through. We only have a few minutes left. Let me talk to Sherelle right quick. Sherelle, you've been out and about too at some of the community events. I just need you to give us a quick snippet of what you've experienced as you've been out working in community. And we're going to talk a little bit later about where people can go. But from your experience as a health department professional and looking at emergency preparedness, what's been the key thing that you've want us to know about when we go to our community sites?
The key thing I would like for everyone to know is that we are there to help. We are there to educate, and we're there to administer the vaccine to protect our population. We make it as convenient as possible. It doesn't take more than 15 minutes to fill out your paperwork and get through the line and get your shot. And we also observe you all to make sure that you don't have any reactions to the vaccine. We put in a lot of efforts to make people in the community feel comfortable to come to the sites. We provide snacks, drinks, we provide picture stations, characters for the children. And it's a friendly environment. And for the most part, we like to promote safety.
One thing I can say, Shira, I've been to every one of our community sites. Again, we'll display those in a minute. And all of the staff at each one of those sites have been very, very friendly and very, very easy to talk to. So we want to encourage our community members. We have these sites. Let's be sure that we utilize them. I know sometimes the lines may be a little bit long hither and thither, but it's important that we make sure we use those. So we want to give kudos to the health department for helping to organize those events and keeping them stood up. Kiana from the city of Flint. Kiana, if you could just give us what are the things that are happening in the city of Flint out of our mayor's office that you'd like our participants to know today?
Yes, hello, good afternoon, everybody. I did want to start by just saying, Yvonne, and to the HFRCC team, thanks for this 100th webinar. You all know that Lottie and I generally switch off weeks, and I'm taking her place this week. And I'm so happy I was here to have the opportunity to hear everybody share their stories, and really to be reminded of where we are in this journey. So again, I wanted to say thank you to you all for the work that you're doing. And thanks to everybody else on the call as well for the work that you're doing. I just have one announcement that I wanted to share this week, and it's related to the community conversations around the ARPA dollars. And so Mayor Neely and some of the administration are going out beginning on February 17th, along with Ernst & Young, to have conversations in the community about the ways in which our city will spend the $94.7 million. So on the 17th, you can find the mayor at Mott Community College at the Event Center, and on the 22nd at Sylvester Broom in North Flint. On March 3rd at the Accelerated Learning Academy. Now that's the old Scott School for everybody. I had to go look that one up myself. I didn't remember that. So over on Averill Avenue, and then at IINN on March 8th. All of the conversations go from 6 to 7:30. So we look forward to the community coming out and engaging in that conversation.
Thank you, Kiana. Just to be sure people understand what that ARPA is. I know you've got it written up here, but that is?
Those are the American Rescue Plan. It's the American Rescue Plan Act. So these are dollars that have come from the federal government to be spent in our community.
And you're saying our community has an opportunity to give voice to how these dollars are spent?
Absolutely. And we encourage everyone who is willing, who would like to come out. If you look at the socials also, even if you can't join in person, there is an opportunity to share your questions online and send them in so that you can have your questions answered about whatever it is that you're asking about around how to spend those dollars.
Thank you so much, Kiana. We appreciate that. There's one last thing that we want to cover today before we go to our final announcements. And we've talked about this periodically, and Dr. Deborah, these numbers, how we are looking at the race data. Can you just give us briefly where we are this week? And if it's too much, we can hold it for next week. But I just think it's really an important element for us to continue to bring forward.
Yep, lips moving on mute. The thing that I think is most important in that I want to share is that the numbers are going in the right direction. The rates are decreasing. We had a 50% drop in cases last week, and we kind of have like another 50% plus drop. So things are moving in the right direction. This is really, really good news. People like myself like to see 4 or 5 consecutive time points in order to be able to talk about a trend. So it does look like we're kind of on what we call in science, the descending limb of the curve. This is the ascending limb, this is the descending limb. And so things are going in the right direction. With respect to the issues around equity, we still battle this issue with so much missing data on race. And it turns out what we're finding out is our people are doing a really good job at collecting it. Many of the people who are getting tested are registering online or on their phones, and they're doing it in advance. There's a gap in what gets communicated from the testing facility, however, and what makes it to the health department. There's a tremendous amount of work that goes into backfilling that data, and we continue to do the work to map out geographically where those unknown cases are, race cases are, so we can just keep an eye on, have we really kept those disparities closed? I'm just really hoping that we can get some state and federal legislation that requires anybody who takes these dollars, whether you be the person administering the test or the lab doing the test, that you have to send all the data back. You have to send all the data back. They send back gender, they send back address, but just somehow like somebody's being lazy somewhere and not inputting the race data. But all signs point to we've kept those gaps closed too. So stay the course, folks.
Thank you, Dr. Deborah. And one way we here in this community really understand it is, and Dr. Wolford and Dr. Deborah, you mentioned this, people need a primary care physician. There are individuals who don't have health care. I need just Jim Melanowski, give us 30 seconds. Give us 30 seconds of what we have in this community to help our community members. Everyone should have health coverage. And what's the Genesee Health Plan doing to ensure that?
Thank you, Yvonne. Yeah, I want to piggyback on what Dr. Verholden said. It's important to have a primary care physician, primary care relationship, but you're going to need probably healthcare coverage to pay for that visit and have ongoing visits with your medical community. So Genesee Health Plan is available to enroll people into healthcare, and we can figure out what that is, but we really can be a one-stop shop for somebody who, there should not be anybody in our community that we're interacting with that does not have healthcare coverage.
Well, thank you, Jim. You did that so well. Got it all in there. Thank you. So now as we round it out today, we always want everybody to know where they can go to get the vaccines. And so I'm going to ask Sherelle if she joined me in this conversation. The community, these clinics are available. We talk about them every week. We just want to emphasize at the health department vaccine sites. They can get boosters and they can get the original vaccines. And this week, there are going to be some pop-up clinics. Is that right, Sherelle? Pop-up clinics coming up next week.
Yes, that is correct. So I'm just here to remind you that we still have our ongoing sites on Tuesday at Our Lady of Guadalupe. That takes place between 12 and 2 p.m. Wednesdays, Central Church of the Nazarene, we're there from 10 to 12. And on Thursday, always in the evening, you can find us at Shiloh Missionary Baptist Church from 3 to 6 p.m. We do have pop-up clinics coming up in the next 2 weeks. On Saturday, we'll be at Agape Church. That's from 12:30 to 2:30. And then Sunday, for those who can't make it to the clinic during the week, we do have Church Without Walls happening from 9:30 to 12:30. We do offer Pfizer, we offer Moderna first and second doses as well as booster doses. And then those sites where you can get your testing for free, Word of Life Church, Bethel United Methodist, and Macedonia Baptist Church. Those sites also offer Moderna and Pfizer first and second doses as well as the booster dose.
And so Sherelle, just quickly, we're going to be, they can also get, they can get vaccines and testings at those sites. Is that correct?
Correct.
And I'm going to quickly run through here. We have the other testing sites we want to make our community aware of. Don't forget, if you can't get into any of those sites, you can go to these sites that are on the screen: Walgreens, Hamilton, and Rite Aid. And as we round this out today, thank you, Sherelle. There is additional support. Please give the health department a call at 810-344-800. I missed that number. And then, of course, there's some mini police station supported by the city of Flint and MDHHS, Hasselbring North End Mini Station, and the South Flint Plaza. Now, we had so much good talk today. I've got to make sure we get out of here this 100th on time, and I think I got about 30 seconds. So social workers and community health workers, please apply for those continuing health, those contact hours and the community education units. I'm trying to get it done fast. Let me just say to you, join us next week. Like us on Facebook. Join us and subscribe to our Healthy Flint YouTube channel. And if you have any questions, please contact us at info@hfrcc.org. Call us at 810-834-2130. And I tell you, we will be back here next week for week 101. We've got some good insights for you. Thank you for your participation. Could not have done this without you coming to the webinar and participating in the webinar. All of our panelists, we thank you so much, organizations, for making this a reality for our community. Again, join us next week for the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. Thank you.